This is Dr. Pawluk. Welcome back to the Pain Solution Summit. We have a special guest today who's in a new area of science relating to pain and just in general, a new area of science, and it's Beth O'Hara. And the topic of today's interview and session is called the Mast Cell Activation as a cause of your pain and a whole host of other problems. And Beth is an expert in this area. So let me introduce you to Beth O'Hara, and Beth will tell us a bit about herself and how she got to this point in her career and life.
Hi, Bill. It's so good to be here with you, and I'm really excited about covering this topic together because this has been a big game changer for so many people. And I think it's going to be a big game changer for people listening to this summit, especially people who are in chronic pain and are struggling. So to tell you a little bit about myself, I'm a functional naturopath, and I have a practice in Cincinnati, Ohio, but I'm mostly based remotely around the United States and internationally. And I work with people who have issues with mast cell activation syndrome and histamine intolerance and related conditions that we're going to talk about today. And especially people that are struggling with these kind of chronic pain conditions. But I didn't immediately go into functional naturopathy. So originally I was going to go to medical school, and that had been my dream since I was 6 years old. That's when I decided I was going to be a doctor. But I always had these health mysteries and never felt quite great. When I was 16, I was in a significant car accident. And what I didn't know at the time was that I had major hypermobility. It had never been recognized. So I knew my joints would bend a lot further than other people. But that a car accident knocked some rib ligaments and cartilage loose and also affected some of my vertebrae. Also younger than that, I'd been kicked in the head by a horse and had a traumatic brain injury. So it had pain in my hips. It completely subluxed my tailbone, meaning it's broken as far under as it can go. And I was having hip pain and tailbone pain before even this car accident. But I pushed my way through college and then really crashed in college. My health just couldn't go anymore. I had all these mysterious symptoms. I had really significant allergies. I would break out in hives. Itching all the time. After I was kicked by the horse and had the brain injury, I had a lot of insomnia, I had anxiety. And by my senior year of working on my bachelor's degree, I just knew there was no way that I was going to be able to handle the stress of medical school. I had chronic fatigue. I was having trouble getting out of bed. So instead of becoming a physician, and I wanted to go into neurology, I had to become a chronically ill patient. And I made my route through everything Western medicine could offer me and tried many different holistic routes. I tried homeopathy, I tried emotional healing and shaman work and anything I could get my hands on that might help me. And I totaled up at one point, I saw over 50 different practitioners and spent over $150,000. And functional medicine became more popular, and I found a really experienced functional medicine physician and had high hopes for that. So that was practitioner number 50. And everything we tried failed on me. I was reacting to the supplements that should be helping. Curcumin, it's really useful for inflammation, made me more inflamed. So I seemed paradoxical in so many ways. And after working with that physician for over 2 years, trying everything diligently he recommended, he finally said, Beth, I don't know what else to do for you. And we've kind of reached the end of what I know to do. And I really appreciate his honesty, but that's the hardest thing to hear when you're desperate. And at that point, I was not sleeping. And when people say, well, you can't go more than a few days without sleeping, that's not true. I went 4 years without sleeping. I could relax and I could kind of drift, but I couldn't sleep. And I was in such severe chronic pain, joint pain, I had to walk with a cane. This was in my 30s. And this walking with a cane started in my 20s. So I felt like my younger years were really ripped away from me. And I had to use that cane just to get to the bathroom. I mean, I was really hobbling. Um, so that was just a miserable life. I really had very little quality of life. And when he said he didn't know where else to go, I knew that it was either I throw in the towel and give up, or I figured this out. And someone the same day reached out to me. Well, I reached out in a group I was in and said, this is what happened. I don't know what else to do. I'm desperate. And a friend of mine said, you know, run your 23andMe genetics. That's all we had back then. This was maybe around 10 years ago. She said, I think you're going to find some answers. And I started finding some answers and I started putting it together. And I realized if I was going to heal, I was going to have to become the practitioner I thought I started out on the road to become. But I kind of went at this different road into a more holistic route and studied genetic analysis. I got myself better to where I was off that cane when I realized it was oxalates, which is something I'd love to talk about. Oxalates were affecting my joints and causing the joint pain. When I addressed that, I was off that cane in 2 weeks. My pain was down 50%, which for me was huge. And I was much better within a few years. It took a lot of work. And I went back to graduate school and finally I've got a master's in marriage and family therapy, focusing on psychoneuroimmunology, the mind-body connection and mast cell activation syndrome. And then got my doctorate in functional naturopathy, specializing in functional medicine approaches. And I myself have mast cell activation syndrome. So this is the big mystery of why I wasn't getting better. And I have a lot of these genetic variants that make my case different than a lot of people. So that was the key for me, was the genetic analysis, personalizing everything, learning about the mast cell activation syndrome, which back then we didn't have a diagnosis code for. We just got one in 2016. So this is a really new area for a lot of people.
So tell us what a mast cell is.
Sure. So the mast cells are immune cells, and they are, I think of them as the frontline defenders of the body and of the immune system. So if we think of the body like a castle, those mast cells are basically the guards at the gates. And it's their job to monitor what's coming into the body and respond. And so if what's coming into the body is good nutrients, good food, clean air, clean water, they let it in. And then if what's coming in as a toxin is a type of pathogen like a bacteria, a virus, a parasite that shouldn't be there, mold, then the mast cell's job is to create significant amount of inflammation around that invader to isolate it and then signal the rest of the immune response to come in. Mast cells also respond to injuries and create inflammation as a part of signaling or as part of initiating the healing process. So they're really essential in the body. We can't live without these mast cells. However, what's happened is now we live in such a toxic world and we're completely bombarded all the time with toxins, with electromagnetic fields from laptops and cell phones. And there's solid evidence, research evidence now showing that these electromagnetic fields affect the mast cells and create more inflammation. The mast cells are getting dysregulated. So instead of them being able to do their job, recognize, okay, this is a virus that shouldn't be here, let's fight this off, and then stand down and take a rest, what's happening is they're having to be on guard 24/7. And we didn't evolve for that to be occurring. And so if we think about a guard at a gate should be able to work a shift and go take a rest. But if you have a guard at the gate who has to work 24/7, never gets a rest, they're going to start to not respond normally. And what I say is at that point, instead of only shooting at the invaders and letting the good things in, the mast cells start shooting at the butterflies, which could include even our own tissue. And we can get into these chronic pain conditions when we have this kind of mast cell dysregulation that we're talking about.
So really the mast cells are part of the inflammatory process. and inflammation is at the heart of aging, is at the heart of autoimmune diseases, at the heart of pain syndromes. Virtually any pain has inflammation at its heart, or is a major part of it, right? So inflammation is ubiquitous to everything, because inflammation's job is to...
Well, inflammation's job is to produce swelling if necessary. To isolate an invader, inflammation's job is to initiate that healing response. So we can have different things that are happening with that inflammation, but then that inflammation can get out of control and create what I call a mast cell cascade. And this happens because these mast cells are also really fascinating cells in that they have over 200 different mediators that they can release, and they can release those selectively depending on what's going on. So the one people have probably heard of the most is histamine. That's the best known one. If we have allergies, we can get swelling, eyes, itchy eyes, post-nasal drip, nasal congestion, sneezing, and then we take an antihistamine and that calms that down. Well, what that's doing is reducing the histamine load. Or sometimes people take some things that are mast cell stabilizing. With these different mediators, we have over 200 in addition to histamine. Another one people may have heard of are prostaglandins. Prostaglandins are very involved in pain signaling. And then there's so many others, again, that create inflammation. If we have a little inflammation, that's good. We don't want to dampen down all inflammation in the body because, again, that's how we control pathogens. That's how we initiate the healing response. But what can happen is like what happened to me when I was in a car accident a few years ago. So not the one I talked about before as a teenager, but more recently. And I was T-boned. And I knew I was injured because I had a concussion. I was sore, and I was sore the next day. But I really thought that within a week or two, this was going to start wearing off. But what we found in my case, that would be the normal kind of inflammatory response after a car accident. But what we found in my case was my inflammation kept building and my pain kept building. And the more the inflammation, the pain kept building, the more my tissues, like my ligaments and joints, became more loose, and that created even more pain. With these mast cells, if they're dysregulated, we get an inflammatory response to the initial injury. And then because of all of this dysregulation with toxins, or in my case, it was mold toxicity that was keeping everything stirred up, in addition to some of these other factors that we've talked about that I have going on, and we can get into those a little bit more. But the mast cells created the initial inflammation from the injury, which triggered the surrounding mast cells to create more inflammation, which triggered the surrounding mast cells. And so the inflammation just kept building exponentially. And the level of pain and inflammation for me did not level off until 6 months after that accident. So it was so severe, I couldn't lie down for more than 45 minutes at a time, which meant I wasn't sleeping, which was worsening the inflammatory response, dysregulating the mast cells more. So my big lesson learned there was when there's an injury, if somebody has these kind of chronic inflammatory issues, we have to address those mast cells right away and stop that cascade from building, because it ended up taking me 2.5 years to recover from that accident.
Now, what you're saying, I think, is very, very important. So number one, I think what I'm hearing correctly, correct if I'm wrong, is that you probably had the mold issue already.
I did, yes.
Right? So that was pre-existing. It was there before you even had the accident.
Right, but I didn't know about it.
But you didn't know. So it's there quietly in the background. And then you had the accident, which flared up the inflammatory system in the body, which is supposed to, right? And then normally, as you said, that's acute inflammation. That acute inflammation should have settled down. But because you had this underlying condition of the mold toxicity and the mold stimulation, mold irritability, the mast cells are already being sort of activated. They're already humming in the background. And then bingo, everything exploded with that injury. So a lesson here is that if you have a problem or a pain or a trauma and it doesn't get better, in a traditional, typical fashion, like 2 weeks, 3 weeks, 4 weeks, 6 weeks later, and it goes on. The definition of chronic pain is you have pain for more than 3 months. After that, it's considered chronic. Now, it may be chronic already. You can say, well, it's going to be chronic anyway. But let's say for our purposes, we're defining it as 3 months. So if your inflammatory process doesn't get better before 3 months, then there's got to be some other reason that it's being continued to be activated.
Exactly. And so what I tell people is this mast cell issue or mast cell activation syndrome itself. And let's look at the statistics for that. So even though people haven't heard of it, it's extremely common. It's between, the research is showing us it's between 9 and 17% of the population, the general population, have mast cell activation syndrome. That's a lot. That's probably 1 in 10 or more. And then in the chronically ill population, people that have any kind of chronic health issue, we're finding it's at least 50%. And I think it's extremely common in chronic pain. And the reason why is mast cells are in almost all of the tissues of the body. So they're in the muscles, they're in the bones, they're in the joints, they surround the nerves, they regulate nerve signaling. There's significant amounts of mast cells in the brain and the central nervous system. So again, pain signaling, we can think of that. And they are involved in regulating sleep. So if we're not sleeping, chronic pain is going to get worse. Chronic pain worsens sleep. And they're in the entire GI tract. So there's so many types of pain we can think of. They line the bladder. So if we think about bladder pain, and anywhere we have inflammation, we have mast cell activation involved. So the mast cells initiate the inflammatory response, and then inflammation further triggers the mast cells. And the mast cells are one of the first responders to any kind of pain. So it's their job, along with the nerve signaling, to recognize if I've put my hand on a hot stove, the nerve signals will tell me hands on the hot stove, jerk away. The mast cells are also involved in that response to move away from a painful stimulus. So this is huge for people. And I referenced the allergic symptoms before that I had, but not everybody has those, and not everybody has the hives. It depends on what systems are involved. So some people, like I have a client, and I'll call her Cynthia, and she doesn't have the classic allergy or skin symptoms. She was actually told by her allergist that she couldn't have mast cell activation syndrome because she didn't have itching and she didn't have allergy symptoms, but it's not actually accurate. She had GI symptoms. She had trouble with sleep and shooting nerve pain. But when we looked at her entire health history, and I have a symptom survey that people can take, a mast cell activation syndrome symptom survey, it became clear that she had multiple systems involved. There was mast cell involvement, even though her skin and basically the allergy symptoms we think of with the eyes and the nose weren't involved. So anytime there's pain, chronic pain issues, no matter where the location is, we likely have mast cell involvement. What's important to know about that is when there's mast cell involvement, there's so much we can do to dampen it down. And when people are stuck in chronic pain and they are not finding solutions, or they're on this kind of cycle of just painkillers and trying to manage it, what we have to do is go underneath and look at what's triggering this chronic inflammation. So I tell all of my clients, mast cell activation syndrome is not the actual problem. It's what's triggering the mast cells, because they're just doing their best job to take care of the body. But what's keeping them stirred up? So things like could be mold toxicity, could be chronic infections like Lyme or chronic Epstein-Barr, can be hormone dysregulation as another root cause. And we can talk about those more in a little bit, Bill, but that's what I want people thinking about, and thinking about, do I have mystery symptoms in 2 or more systems in my body, like my GI tract and trouble sleeping? Or do I have mood shifts and I have itching? Or do I have joint pain and I have pelvic or bladder pain? So if we've got 2 or more systems involved, or if we've got a chronic injury that's been going on for a long time, post-operative pain that's been going on for more than 3 months, then we've probably got some mast cell activity that's out of control.
That's a great way to look at it. Well, but that segues us. So if you think you have mast cell activation, and let's assume for a second, as you said, if you have chronic pain, there's a really good chance, especially if you have all the other symptoms, other systems that are also being activated. So you mentioned the gut, the lungs can react, the bronchi can react, sinuses, chronic sinus problems, chronic tonsillar problems. What about sort of aches and pains anywhere in the body, right? Joint aches and pains, muscle aches and pains.
Right. And sometimes they move around.
And they can migrate?
Yes, it can migrate. So think about bones hurting with weather changes, fibromyalgia, muscular pain. There's a big connection with the mast cells and that kind of muscular pain, chronic muscular pain. With the lungs, like you're talking about, people can have asthma, or they can just have tightness of breath, or the chest tightens up. A lot of times people have trouble with stronger smells if they have those lung involvement. That's not always there, but they may have trouble with like the laundry detergent aisle, all of the fragrance laundry detergents. Fragrances are a big mast cell trigger. So something that I help my clients do is we step through, okay, what are the products in your home that could be triggering you? And people are often surprised, things like scented candles, those plug-in fragrances. I've been a little flared up lately because I've been house shopping and I'm going into all of these homes, and two things are flaring me. Lots of people have fragrance plugins, and the other is I had cleared up all of my mold toxicity, which was contributing to Ehlers-Danlos hypermobility, which is a type of issue where the connective tissue, the ligaments and the tendons and the joints become too loose, a little spongy, and they don't hold the bones close enough together. And that had completely resolved for me, addressing the mold toxicity. But now going into these homes, lots of homes have mold, and I can smell it when I go in. I'm real sensitive to it. My joints are shifting again. So just had to actually go get an adjustment because my ribs are shifting, and that's painful. My SI joint's been shifting. And then, of course, the fragrance again.
Well, you mentioned Ehlers-Danlos. So how does EDS, you mentioned how the joints become loose, but how does that correlate with MCS? How do the two tie together in terms of cause, or what's their anatomic or physiologic relationship?
So what we definitely know from the research is there's what's called a triad, which is mast cell activation syndrome, Ehlers-Danlos hypermobility type. There are different types of Ehlers-Danlos that are very genetic.
Or EDS for short.
EDS for short. And then POTS, so the postural orthostatic tachycardia syndrome. And that POTS is where people have big swings in blood pressure. So like I have a young girl, I work with a number of children, and I have a girl who's about 12. And when she would get out of bed in the morning, she would start to see stars, is how she described it, and then almost pass out. And a couple of times she did pass out. And that was, we measured her blood pressure, and her blood pressure when lying down would be normal for a child. When she stood up, it was dramatically dropping. Now, not everybody has that intensity of drop, but maybe just dizziness, lightheadedness, standing up. We'll a lot of times see that. The way these are related is, again, those mast cells are in the joint tissue, and they also surround all of the blood vessels. They're inside the blood vessels. When we have chronic mast cell inflammation, that chronic inflammation causes the joint tissues to get a little spongier, and the bones will shift more than they should. And it's not necessarily everywhere, it can be more localized in certain places. A lot of people who are contortionists have Ehlers-Danlos hypermobility, and that's an extreme.
Soleil.
Yes, think Cirque du Soleil. I actually had one of their acrobats as a client, and the movements that she could do were amazing, but she had significant chronic pain. And it's part of that pain is because pain, we have a lot of nerve endings in these joints. And when the joints aren't fully seated, so that the bones are coming in towards each other, then we have chronic pain. It's like having static in that joint all the time. One of the most pain relieving things for me is to go scuba diving, because of the pressure pushes all of my joints in together, and it feels really good. Sometimes people with hypermobility will wear compression garments because it feels good to pull the joints in. And they actually make compression shirts for the arms and things like that. And so the Ehlers-Danlos is often what's underneath this Ehlers-Danlos hypermobility. What I see over and over and over is Bartonella or other co-infections, Lyme co-infections, that affect the tissue there, the connective tissue in the joints, and mold toxicity. Mold toxins are really, really hard on the joint tissue, the connective tissue. So the good news situation of that is we clean that up, people get dramatically better. I can no longer hyperextend my elbows and knees, which for me, I've been able to hyperextend my whole life, and they just won't bend past normal anymore. So that's pretty incredible for me. And then the reason that the POTS piece, this blood pressure piece, goes along with it is the mast cells lining the blood vessels can create inflammation, and the blood vessels get a little more loose, it's a little more elastic in the tissue. So if we think about, if we're pumping water through a normal garden hose, we're going to get really good flow, water pressure flow. If we're pumping it through material that's like a balloon, you can think about how a water balloon will kind of expand out. And people can sometimes see on their hands, they'll start to see the veins pop out, and the veins will become more visible. And that can be part of that mast cell response there in the blood vessels themselves. And that can come and go for people.
I think probably it's important to clarify for people, MCAS doesn't cause EDS. Right? EDS is in fact a syndrome by itself, and it has a huge genetic component to it. So now when you're combining genetics for these different conditions, 1 + 1 doesn't equal 2. It's much more exacerbated.
Yeah, it's much more complex. So the Ehlers-Danlos is very correlated with the mast cell activation syndrome, and it's because they have these similar underlying root triggers. And also the mast cells are involved in what's happening there in the joints. And there are clear genetic markers for many of the types of EDS, but the hypermobility type, they haven't found a genetic marker for. And I think this is because it's an inflammatory condition. And there are some genetic markers for mast cell activation syndrome also. There's a genetic type, but it's much more rare. What we have for most people is a secondary mast cell activation syndrome, where it's getting stirred up by these root triggers. And it's not necessarily primarily genetic like some conditions or some other mast cell disorders, like there's a disorder called mastocytosis, and that's a rare condition that is genetic, and it's a genetic mutation that causes too many mast cells. So that's not what we're talking about here. We're talking about where these mast cells, we have normal numbers of mast cells, but they're out of control from toxin exposure, and we all have toxin exposure. I run chemical toxin panels on clients, and I've had one client out of hundreds who didn't have significant levels of chemical toxins. And this is either from air pollution, from the water we drink, even really good city tap water, like the best rated, still has pharmaceuticals in it. They have pesticides, they have Roundup. We check for Roundup. Lots of people who are eating organic still have Roundup in their bodies, and it's coming from the water source, or it's coming even from the shower, where the shower water is not filtered. They're absorbing it through their skin, or it can drift from the conventional crops over into the organic fields. So we have a major toxicity issue. And we did have these kinds of mast cell problems and the associated conditions. For example, autism is associated with mast cell activation syndrome because of inflammation in the brain. Autism is strongly on the rise. So is chronic pain, so is mast cell activation syndrome, certain cancers, and they all have this underlying toxin issue. And And the mold toxin issue, mold toxicity is on the rise also. And a big part of that is the electromagnetic fields dysregulating the mold growth cycles and accelerating those growth cycles. So all of these things are affecting all of us, and we have to work much harder to stay healthy in the world that we live in today than we had to 50 or 100 years ago.
I think if you go back, based on what you're saying, it sounds like the EDS and even the MCAS are probably present in childhood. We don't recognize them yet, right? And so for EDS with hypermobility, if you see a child with hypermobility, then you should be looking for these other signs that there may be some other MCAS stuff going on, right?
So I see two presentations. One is exactly what you're talking about and is also what was going on with me. So as a child, I had colic. I was just never well. I was sick often, very early allergy symptoms, food sensitivities. And so this will be there from my childhood. Now, I grew up in an old farmhouse that I learned much later in life was full of toxic mold. We didn't know it when we lived there, and I lived there 10 years. I grew up on farmland where they were spraying the fields with pesticides, and that came into our water source. We had well water that came into the air. We'd have to run inside when they would spray the fields because you couldn't breathe it. And then I also see presentation where people have been fairly healthy through their life, and then something happens that turns it on. And so I have some people who there were clues early on, and then something really accelerated it. I have other people that really never had allergies, never had health issues. They could drink beer and eat, their bread and eat gluten and do everything and feel really good. And then boom, something happened. So I have a client who she was just like this. She would brew beer with her dad and do all these things, eat pizza, all this stuff, a lot of people do. And then she bought a house, moved in, started not feeling well, went to renovate the kitchen. They pulled the cabinets off the walls, and the walls were completely covered with black mold. And this was about a year into living there. They found the mold, and she was already significantly ill at that time. And so the mold toxicity turned on mast cell activation syndrome for her. She ended up with some hypermobility, and cleaning up the mold toxin has been helping quite a bit. But looking at her health history, there was just no clue earlier in life. I also see this turning on for people with really aggressive Lyme treatments with lots of antibiotics. Antibiotic use can turn it on. Lots of painkiller use can turn on mast cell activation syndrome. So a number of painkillers that are mast cell activating, things like oxycodone, morphine. And then it can get turned on with people have traumatic events. It can get turned on post-surgery and also with significant injury.
So again, if you have the predisposition to it. Now, do you do any genetic testing for MCAS?
I do a significant amount of genetic analysis. So I do look at the KIT genes to see if something could be there. Those KIT genes are the ones that are implicated in that rare condition called mastocytosis. There's also a form of mast cell activation syndrome called clonal mast cell activation syndrome. That means it's genetic. That is fairly rare. I don't see it very often. But I do evaluate over 10,000 genes that can cause inflammatory issues in the body. And anytime we have chronic inflammation, we're going to end up with some mast cell dysregulation. So this is part of that root cause analysis, is looking at the genetic factors. So these are things like genetic factors that contribute to iron overload issues, which are going to cause mast cell issues. Genetic factors that can contribute to oxalates, but we can also have oxalate issues from food, eating too many high oxalate foods. And those oxalates in foods look like little shards of glass or little razor blades under a microscope. This is a big cause of fibromyalgia. They lodge in the muscle tissue and cause significant pain. They lodge in the joints. That's what caused my joint pain. I was eating lots of sweet potatoes and beets and spinach and all high oxalate foods. and then the oxalates trigger mast cell activation. So I look at those kinds of things. I look at the detox pathways. I look at methylation, many, many different areas that can be involved, nitric oxide. So we're looking at, again, underlying root things that are keeping the body dysregulated, keep these inflammatory states dysregulated, and increasing these pain syndromes.
So I think what you're saying, what I'm hearing you saying, is that there's no specific genetic indicator for MCAS.
Exactly, for the for 99% of it,
Right.
of cases, exactly. And this is why we have to do this kind of root cause analysis. And so when I do that root cause analysis, there's 7 major root triggers. There are other minor ones, but the biggest ones that I see are the toxins and the infections. It's people's diet. And this is beyond just talking about not eating sugar and eating less wheat, which are big pain triggers for people. But there are very specific things that people may be eating that seem healthy. For example, eating too much bone broth, fermented foods, kombucha, these things we think of as being really healthy, they're all high histamine foods. And so if people have chronic pain and inflammation, those high histamine foods are going to trigger mast cell inflammation. And so they may not be the best foods for people in an inflammatory state. Even gut healing, if people have mast cell involvement in the gut, bone broth can actually make it worse. So we have to be able to really personalize these things. Who should be doing bone broth and who shouldn't? Because what's the most healing food for somebody else could be worsening health issues for another person. That's what I found in my case. So in my case, sweet potatoes, spinach, beets, bone broth, ferments, I was trying my best to eat healthy, were making me worse. And I still eat really healthy, but now I know how to hone in and customize my foods. We've got genetic factors, but these are genetic factors that we're looking at that are stirring up inflammatory issues, affecting pain signaling, even things like high glutamate levels, that's overstimulating to the nervous system, can affect pain signaling. Of course, infections are a big one, chronic infections that we've been talking about in the mold toxicity. There are nutrient deficiencies that affect people and affects the mast cells, especially if people aren't eating enough sulfur foods like cabbage, broccoli, cauliflower. I see this, people have certain digestive issues that have trouble with those foods. This is because the mast cells need sulfur to stabilize themselves.
Mm.
And there are protocols out there like the Walsh protocol that are highly sulfur food based. And that's giving a ton of sulfates for the mast cells to stabilize themselves. Hormone imbalances, so having estrogen dominance, which can even happen in women in menopause where there's more estrogen than progesterone, even if both are low. That triggers a lot of mast cell activation. Not having enough oxygen because of airway blockages, which is why I have braces on to fix my airway. So it can be sleep apnea, or I don't have apnea, but actually my dental arch was too narrow. So I assess people for that and see if they need to. Sometimes people just need a little sleep appliance. And then stress is a huge one because chronic stress affects mast cell activation syndrome, is going to create more inflammation, is going to create more pain, and is going to affect the pain signaling. So these are all involved, and I know that we don't have time to really drill into them all, but I do have a free report I'll refer people to if they want to get more information on that.
So you could offer that as a gift or a bonus for people who view your segment or the course. So basically what we're saying is that a lot of the evaluation that you're doing is not pointed at the MCAS as a specific disease. It's pointed at the things that activate.
Exactly. So again, going back to the mast cell activation syndrome isn't the problem. It's a symptom of the problem, or a huge collection of possible symptoms of the problem. It's what's triggering it underneath that's causing it. And so if you have chronic pain, if you have chronic inflammatory pain, wherever it is, if it's migraines, if it's joint pain, if it's bladder pain, if it's disc pain, If it's bone pain, I mean, we could just keep going on with all the different types of pain, even non-heart attack related chest pain. There's going to be mast cell involvement. And the more that we can clean up what I call the landscape underneath, the more that we're going to reduce those pain levels. And I know chronic pain intimately myself. So I've had nights upon nights upon nights of only being able to lie down for 45 minutes and then having to get up and pace due to severe pain. I've had pain at 10 of a 10 on my pain scale for months on end, and chronic pain at a level 8 out of 10 for years on end. So I know very well what it's like to be in that much pain and to have that kind of inflammation, and then to be able to get that inflammation down, not by just taking tons of anti-inflammatories, because what that does is causes more problems down the road, but actually cleaning up what's triggering the inflammation. And I got my life back. I got my life back to the point that I could go to graduate school and build this whole practice. And so that level of pain now feels like it was a whole different lifetime ago, but it's awful to live in that day in and day out. And it is amazing to get to have that reduced. And I'm not pain-free. I'm not, a rose-colored glasses kind of person. I'm quite a pragmatist, and I'm pretty direct about what we can do. So I would say my pain's at about 10% of what it used to be. I still have some pain because I have some significant injuries. My tailbone's broken all the way under. I have 2 fractured compression fracture vertebrae. I have ligament damage in my neck and my ribs from injuries, but they don't hold me back anymore. And I can do whatever I want to do in life within reason. I'm not rock climbing, and I'm not doing, competition bodybuilding and weightlifting. But outside of that, I do everything I want to do, and I'm not held back. And I think this is the key, is that we have to take these root causes approaches. So if we just do anti-inflammatories, then what that can do is it dampens the mast cell response so much that we may be out of pain, but now the mast cells are taken out of commission, and you've basically left the front gate to the castle open so that mold, toxins, pathogens can come in, and there's not a guard there to protect the body. And I think this is why I got so sick, Bill, because early on I was put on lots of antihistamines, and I was put on anti-inflammatories and steroids. And I was at a young age as a child and into my teen years, and I took those up into my 20s when I decided this isn't working. Well, I had the underlying mold toxicity I told you about. I also had Lyme, Bartonella, and Babesia. And those antihistamines taking my mast cells out of the picture and the anti-inflammatories dampening down the response did help with my symptoms, but then my mast cell activation syndrome became progressively worse over time. So it helped initially, and then I need more and more medications. And the pain meds, I wouldn't touch the pain anymore at all. And then the mold toxicity, the mold in my body, and the Lyme, the Babesia, the Bartonella had free reign and to increase the infection there. So that approach, people do try, but I see people get progressively worse, unfortunately, that way. I think the way that, and what I've seen in my practice, the way people really recover is when we do the root cause analysis, we find out what's exactly triggering that person, and then we customize the protocols to clean that up.
That's a really important approach. And when you think about MCAS, because people may read about it and decide that there is in fact a syndrome of MCAS. But what you're saying is that, in a sense, mast cell activation is a normal background event in the body. It's there as a control mechanism. Now, there may be times when MCAS is truly present. So now, would you go into a deep dive assessment of MCAS specifically, or would you, like, for example, doing some lab work for MCAS versus dealing with what you're describing then as the background work that you have to do to control the triggers?
Yeah, that's a great question. I don't personally recommend the blood work for the MCAS markers that are part of the diagnostic criteria. And the reason is that they're not very reliable, unfortunately. The diagnostic criteria is very new. So again, we only got that in 2016. It's still evolving, but the problem with the blood work for the markers people can get. So tryptase is important to rule out mastocytosis. So that one is important.
That's an easy blood test that most labs will do.
Exactly. And somebody has that, then they likely are going to need some medication support in addition to this kind of approach. But this approach is very helpful and does work for mastocytosis. But then there are other markers that are used for the diagnostic criteria. The problem with them, one, they can easily be mishandled by the lab and you'll get false negatives. They're also only elevated temporarily. And so you have to catch it right at the right time. And so a number of practitioners that can run blood work right in their office will keep their patients there for maybe 8 hours, have them eat a bunch of foods that are triggering for them and whatever their other triggers are, maybe expose themselves to lots of fragrance smells, whatever sets off their mast cells so that they're flared up, and then have them come in and draw the blood every hour on the hour until they get an elevation so that they can get coverage for insurance purposes. To me, that says that we don't have the diagnostic criteria very well organized yet, that it needs to be different, basically. That's too much. That tells me that that's not a good diagnostic criteria. I don't personally worry about those markers. I worry about what symptoms are people having, what kind of inflammation are we looking at, what kind of pain are we looking at, what is the history here, what is the background. So my intake packet is extensive. And I always tell people, I'm really sorry. I know it's a lot of work. However, it's what allows me to do my job, because by the time people come to me, they've already seen a bunch of people. They've already tried a lot of things. And so once they get in my door, we have to turn over every stone and find out what was missing. And that's what I excel at, is that detective work. And that is what I focus on. And then getting the type of testing we need to see what are these root triggers, what are the chemical toxins, do we have mold toxicity if it makes sense for that case, what is going on with hormones, is there enough cortisol, which is important for mast cell stabilizing, and what are the micronutrient, what do the micronutrients look like, do we have enough sulfates, what are the blood micronutrients and the micronutrients inside the cell, because there are many that are needed by those mast cells. And it's just so common in the chronically ill population. Even if somebody comes in and they don't have the classic picture of mast cell activation syndrome, or we're not sure, this approach is going to help, because these root triggers trigger inflammation in general and so many different problems in the body.
So if you think about it from a medical perspective, so as a medical doctor, I would love to have a test, let's say a provocative test. So I have a provocative test and I give that provocation to somebody. Then you can measure the mast cell activation or the histamine level or the tryptase level or other levels. But we don't have that yet from what you're describing, A. And even if you did, even if that was positive or if that was negative, that doesn't mean that you don't have other triggers. It's going to be often multiple triggers that are going to activate you, not just one single trigger that you can easily measure.
Exactly. And I think this is why this has fallen off the radar for so many people in the healthcare profession. It's complicated, it's complex, it's really challenging, and it takes a lot of in-depth knowledge and also a lot of determination. When I take somebody on, I take them on, and we're in it for the long haul to put this together. So it's usually a minimum 6-month road. It may be 2 or 3 years, depending on how complex the person's case is. But I'm very dedicated to people, because what you're describing is like, we have to look at each layer until we've got it and we've got them where they want to be.
All right, so people will read on the internet and they'll read about MCAS on the internet, and they'll read about what doctors do to treat MCAS. And there are some very specific treatments that are being touted or recommended or said to be, the standard of care, if you will. So
Right.
what are some of those treatments, and then tell us why they don't work?
Sure. Well, and I think we have to look at what are people's goals. So people come in and they have different goals. People have different bandwidth for doing this kind of stuff. So the traditional treatment is a H1 and H2 blocker combination. So H1 means histamine 1, and that's referring to the type of histamine receptor. H2 means histamine receptor 2. So H1 blockers are things like Claritin, Zyrtec, Benadryl. On the prescription side, there are things like hydroxyzine is the generic. It's also called Atarax. So we have those options for H1 blockers, and then H2 blockers are in the gut. And so these are things like Zantac, Tagamet, those what we think of as acid blockers, or sometimes they'll use proton pump inhibitors.
PPIs, yes.
Yes. So then what may be added on as another layer would be something like Ketotifen, which is the prescription that has to be compounded. It's an off-label that has some mast cell stabilizing effects, or Singulair that has a little different effect. So that's used if there's lung symptoms. So this is the pharma.
That's a leukotriene inhibitor.
Exactly. And then in the traditional medical model, those will be attempted systematically. One of the problems is most of those have fillers in them that are mast cell triggering. And so not everybody reacts to those fillers, but things like titanium dioxide, or they have coloring. So just because there's a failed experiment doesn't mean that this isn't going to work. Then they move on to the next one, or try to get them all compounded, which will get pricey. So there's a number of medications that can be tried. If people don't have a lot of bandwidth to work on their health, then that's the way to go. And that is an okay approach. The problem is that it does mean the mast cell activation syndrome will be progressive. And the traditional medical perspective on mast cell activation syndrome is that it's a progressive degenerative disorder. Each time somebody has another trigger, like an accident or an operation, they will continue to get worse and even more flared over time. The reason is because those medications are not fixing the mast cell dysregulation. They're just dampening down the response. The antihistamine medications will block those histamine receptors so they don't register the histamine levels in the body. So that will provide some symptom relief, which is part of the diagnostic criteria also, if antihistamines reduce symptoms. So if people feel better with Benadryl, or some symptoms start to clear up. Now that's not completely definitive, because people could react to the medication also. So if it clears up, that's good, but just if it doesn't clear up, that doesn't mean that it's off, mast cell activation syndrome's off the table. Now, going back to the histamine blockers, when you block these receptors long-term, the body registers not having enough histamine. The body will upregulate its own production of histamine. That's one of those mast cell mediators. The symptoms will start to break through the antihistamine. Then you need more antihistamine. And then the same thing is going to happen. You're going to get breakthrough histamine. You need more antihistamine. You're going to have to change medications. And the more that you're dampening down these mast cells again, you leave the door open for these underlying issues to continue. Now, I'm not anti-medication. There are good cases when people are really severe that medications need to be used initially. And there are cases like mastocytosis, or like my case with the traumatic brain injury. I do have to take a really tiny amount of hydroxyzine. But I keep it very tiny, and I'm always tapering down to eventually someday I'm going to taper off of that. That's because these medications aren't a good long-term approach. And again, it's going to be degenerative. So from a pain perspective, that means we may get some relief with this kind of approach early on, but then the pain's going to break through. It's going to come back. We're going to need more, and we're going to kind of be on a circuit. So that is the approach if people aren't able to or aren't interested in changing their diet, changing their lifestyle, taking supplements, getting functional tests. And that's a fair approach. But if somebody is willing to put the work in with this root cause analysis, with cleaning up the diet, and cleaning up the diet doesn't just mean we'll eat more fruits and vegetables. It means we really customize your foods towards you. So it could be a lower histamine diet, could be something that's lower in something called lectins. Lectins are a type of plant protein that trigger mast cells. And it means taking supplements. It means checking out the functional tests. Doing that route, I've had out of hundreds and hundreds of clients that have come through my door, I've yet to see anybody not get some results. I always tell people, again, completely honest and transparent, I don't always have 100% of the answers. We're always getting big puzzle pieces. And for a lot of people, we really get things cleared up. So the only people who haven't gotten results, again, are the ones that, for whatever reason, aren't able to put that kind of work in or interested in doing that. So if people just ignore it and they don't do anything at all, it's definitely going to continue to get progressive and get worse. But the good news is there is so much we can do with the root cause approach to clean this up and get tons better. People get their lives back. I have a woman I'm going to tell you about, and we'll call her Amy. So Amy, when she came to see me, she was having severe joint pain. And she was extremely exhausted, chronically fatigued. She would drive home from work, and she worked in the education system. So she would get off around 3 o'clock, get in the driveway about 3:30. And then she would need to get inside, but she would end up sitting in her car and falling asleep because she was too exhausted to get out and get in the house. And her pain levels were so high, they were disrupting her sleep. And so we worked together for about a year and cleaned up her diet. We did the genetic analysis and found some things that no one had looked at before. She had seen about 6 other practitioners, but we found she wasn't making enough of something called NADPH, which is important for energy. And then we worked on supporting her mast cells. We worked on this root cause approach, regulating hormones and cleaning up what was underneath. And I got an email, we kind of wrapped up, she was doing much better. And then we put this last piece in for her with that NADPH. And I got an email from her 4 weeks later that she'd taken her daughter to New York and they had walked 20 miles in a week. And so to me, that's a huge success because she couldn't exercise at all before, not even a 10-minute walk, just going to work and coming home and trying to make dinner for her daughter wiped her out. So that's the kind of turnaround we see for people. Or see people that are in so much pain that they're homebound and they can't leave their house. And a client like that, and a year later, she was out traveling and visiting her daughter on a vacation and going to see a few shows together. And she couldn't eat out in restaurants at all. She was eating out in restaurants. So that's very exciting to me.
I absolutely agree with that. And this is a great way to end this segment with a compelling story like that. And I think, as happens with a lot of chronic pain situations, they are complex. It's rarely one approach that's going to make a difference, long term at least. And anybody who gets trapped or sucked into this idea that MCAS, if you have that identified as a potential issue for you, can be dealt with by simply taking an antihistamine or a leukotriene, you need to think comprehensively. And you filled that picture in for us marvelously, perfectly, in fact. So now tell us how people can get at more resources, where they can go to get more information about MCAS.
Absolutely. So the website is Mast Cell 360. So Mast is spelled M-A-S-T as in Tom, C-E-L-L 360.com. The first thing I would do is go to the blog. At the very top of the blog, pinned at the top, is the symptom survey. I would take that symptom survey and see if your symptom profile starts to match the picture. So the symptom survey developed based on the research of symptoms correlated with mast cell activation syndrome. I tell people if you score around the 50 range or above, the higher above, the more likely there's a mast cell activation component. I do have some people with some mast cell involvement around the upper 30 to 40 range, but typically we see 50 and above. If you are scoring 50 and above, then I would definitely look at the free report that goes along here with the summit called the 7 Overlooked Symptoms in Chronic Pain and Mast Cell Activation Syndrome. And so that's really critical piece here. It's going to go into a lot of detail on these root causes, help you evaluate on your own. If you think that these causes are triggering you, which ones exactly do you have? And then you want to find somebody who specializes in this. Unfortunately, there are not a lot of us right now, but there are some people who are specializing in this or doing a really good job. And find somebody who really knows this and has been working with this for at least 4 to 5 years, because that's how long it takes to become an expert in this. And then if people have questions, you can always hit that contact form. And I'm taking new clients. So if you need help, if you identify yourself in there and you need help, just reach out to us.
Thank you so much for giving us that advice and the resources to deal with this. So that's going to be it for today. Beth, thank you very much for taking the time. And I sincerely wish you and anybody listening and viewing all the best in their own health journeys. And may you heal quickly.
Thank you so much, Bill.
Thank you. Bye-bye.